is an article that came out in the Cato Institute, March 12th, 2018. War on opioids have become a war on patients. And, what it's pretty much pointing out is because of all of the illegal drug activity and the opioids that doctors are now cutting back on, people are now turning to the streets for the illicit drugs. See, they thought if they cut the prescriptions that the doctors wrote, that it would cut down on the opioid overdose deaths. It hasn't done a thing. Whoever came up with this policy clearly don't have common sense. If people can't access the drug that's legal, common sense, if they are experiencing pain, they're going to go right to the illicit drug that's easy and readily available and they can get right off of the streets. And that's what's happening. This is why, yeah, they cut back on prescriptions, but the deaths are still going through the roof. All right. As Anne Fuqua recently pointed out in the Washington Post, non-medical drug users accessing heroin and fentanyl in the underground drug market are not only victims in the opioid plague. Many patients for whom prescription opioids are the only relief from a life sentence of torturing pain are also victims. That is because policymakers continue to base their strategies on misguided and simplistic notion that the opioid overdose plague impacting the US, Canada, and Europe is tied to doctors prescribing opioids to their patients in pain. Unfortunately, political leaders and the media operate in an echo chamber, reinforcing the notion that cutting back on doctors prescribing opioids is the key to reducing opioids overdose deaths. So, you see, here's the problem. Even if the doctors cut back on writing prescriptions, if you haven't done anything to curb the drugs on the street, this is totally ineffective. It really is. As a result, all 50 states operate prescription drug monitoring programs that track the prescribing habits of doctors and intimidate them into curtailing the prescription of opioids. Yet, multiple studies suggest that PDMP have no effect on the opioid overdose rate and may be contributing to its increase by driving desperate patients to the dangers that await them in the black market. And that's exactly what they're doing. When they're cutting back on these drugs, instead of doing it by case, and, when people are not abusing it and they have things like cancer or post-op, or they have chronic pain because of nerve damage or anything like that, they should be able to get the drug. Now, somebody that's out here doctor shopping, no, that's the person you cut off. But as long as it's a patient and they have showed no signs of abusing the drug, then that should be okay. How can you cut off somebody that has cancer? And cancer patients are in constant pain. And let's say they're at the end of their life and they got to suffer because of some drug addicts in this country. The problem is they don't know how to fight this thing. Everything that they're doing, it just doesn't work. And the reason why it doesn't work is because they're trying to do everything around punishing the actual drug addict. They don't want to do that. They gave immunity to them. So no matter what they do, they can't be in trouble for their drug habit. And that's the problem. As long as they don't deal with it on the user level, this thing will never get resolved. Never. Okay, so now let's get to last month. Arizona joined a list of 24 states that had been put in place limits on the amount of dosage of opioid doctors may prescribe acute and post-operative pain patients. These actions are based on the amateur misinterpretation of the 2016 opioid guidelines put out by the Center for Disease Control and Prevention and are not evidence based. And the Food and Drug Administration continues to promote the replacement of prescription opioids with abuse deterrent formulations. Despite an abundance of evidence showing this policy only serves to drive non medical users to heroin and fentanyl while raising healthcare costs to health systems and patients. So they're actually making it worse, y'all. With these policies in place, they're actually making the situation worse. And they think they're not making it worse, but they actually are. I guess that's a high IQ for you, huh? As prescriptions continue to decrease, overdose deaths continue to increase. Why? Because they are going to the illicit drugs on the street and in the black market. This is why you're not seeing any changes in the deaths. This is because the non-medical user get reduced access to usable diverted prescription opioids. They migrate to more dangerous fentanyl and heroin. Exactly. Exactly. So your policymakers are actually making the whole situation worse. It's simplistic and thus provides an easy target for politicians and the media to latch on to the false narrative that greedy pharmaceutical companies teamed up with poor, lazy, trained doctors and hooked innocent people on opioids and condemned them to a life of drug addiction. But this has never been the case. As Patrick Michaels pointed out, the recrudescent opiophobia? Is this what they're got? Opiophobia? Opiophobia. Okay. Back in 2004, prescription opioids actually have a low addictive potential when taken by patients under the guidance of a physician, have a very low overdose potential. Cochrane System studies in 2010 and 2012 both found an addiction rate of roughly 1% in chronic non-cancer pain patients. And a January 2018 study in BMJ by researchers at Harvard and Johns Hopkins. And by the way, those are universities that experimented on Black women with no anesthesia. If it wasn't for them dissecting live women during slavery, gynecology would not be as advanced as it is today. So Black women had everything to do with it. Okay. Now let's get back to this. I kind of got off track here. Okay, so they examined 568,000 opioid patients and people that were in post-operative pain between 2008 and 2016 and found a total misuse rate of just 0.6%. And researchers at the University of North Carolina reported in 2016 that 2.2 million residents of the state who were prescribed opioids they found an overdose rate of 0.022% and told policymakers disabuse themselves from the false notion that the opioid overdose crisis is a direct result of doctors prescribing opioids to patients in pain. The opioid overdose rate will continue to climb. Only the type of opioids from which victims are overdosing will change. We have already seen it move from diverted OxyContin and other prescription opioids to heroin, and from heroin to heroin plus fentanyl. Most recently, fentanyl was the predominant cause of overdoses, which is true. The war on opioids being waged by today's policymakers is, in effect, a war on patients in pain. If policymakers are serious about wanting to reduce overdose deaths, they should look to what has been done in Portugal and now Norway and in the war on drugs. If they can't muster the political will to go that far, then they should at least put focus on harm reduction measures, such as a syringe service program, medication assisted treatment. That's when they go to a facility, like a safe house type thing, and a medical professional sit with them while they get high on heroin. That's what they're talking about. And making the overdose antidote naloxone available over the counter instead of a war on opioids. They should wage a war on deaths. So there you have it. You know, all I can say is after reading this article, you don't have to worry about them resolving this thing because they won't. Please leave your comment and subscribe. Don't forget to hit on the notification bell twice and join me over on Black Junction TV and blackspot.com. Peace, family.